Dental Fuel, the podcast that focuses on what no one else is talking about: mistakes. The dental world is full of before and afters, and no one is talking about the middle. Dental Fuel brings you the unspoken in between. Dental Fuel is brought to you by Doctors Disability Specialists, a team dedicated to helping dentists and physicians with disability insurance, life insurance, and comprehensive business planning. In this episode, we have Dr. Emma Guzman-Vizcarrondo. Dr. Guzman is a general and cosmetic dentist practicing in New York City. She completed her doctor of dental surgery degree at the University of Buffalo School of Dental Medicine and was a general practice resident at Bronx Care in the Bronx, New York. Dr. Guzman currently practices in Brooklyn, and her main focus is changing her clients' life by improving their smiles and ultimately their health. In this first episode with Dr. Guzman, she talks about a clinical mistake she made and how that mistake transformed her approach and communication in dentistry. Let's tune in. Emma Guzman, welcome to Dental Fuel. How are you doing today?
I am doing amazing. How are you doing?
I am so excited to have the opportunity to speak with you today and to share a little bit about your story with our listeners.
Yeah, I'm very excited to be here, and I'm super excited that we get to reconnect since, we knew each other
Woo!
the land.
Yeah, good old Azalan making connections since way back when.
Yes, absolutely.
Emma, please tell our listeners, where are you right now?
Okay, so currently I am in Brooklyn, New York, and ever since I graduated dental school, I came back to the city. So I was working in the Bronx, I've been in Harlem, I've been in Long Island, I've been in Bushwick. But right now I am settled in the Park Slope area. If you're originally from Brooklyn, we used to call it downtown Brooklyn back in the day, but now it is Coin Park Slope, right across the street from the Barclays Center. And I am the senior associate dentist at 10 Dental, the Park Slope location.
It's super exciting, and I am excited to talk a little bit about Tend, but tell our listeners, are you from the New York area?
Yes, my family is originally from Guatemala, but I was born and bred in Brooklyn.
I love it. So tell us a little bit about Tend. I think that this is a group that several of us have heard about, kind of in the news in the last few years or so.
Yes.
But I'd love to know more about the practice, how you fit into that practice, how you came to find Tend. Tell us everything about Tend.
Okay, perfect. So 10 is what we may know as a dental service organization. So it's actually headed by someone who is not a dentist, but we have a lot of dentists in hand making sure things go the way they're supposed to be. So from the beginning, we had, Dr. Mark Slenoff, which is somebody who is a big name in NYU. He originally was working with the creators of 10 to, make sure they had all their P's and Q's together on the dental side. And then now, actually, Dr. Chris Salerno is the, chief dental officer at 10. So, we very much so are focused on patient care, making sure we're giving them quality care. 10 originally started prior to the pandemic, and they had a few locations, but the pandemic hit, and they really, went in terms of, how we can make this company better, how we could restructure the design and completely revamped. And since then has opened 20 plus locations. So we have 26 locations around the country, and we're actually going into the Connecticut territory next. So we have locations all around New York City, in Boston, in DC, in Tennessee, which is where our headquarters are. And then we're going into the Connecticut area. So the way that the offices are structured, there are usually around 4 to 5 dentists per office. We have 7 plus hygienists, multiple dental assistants, and it's a pretty good team. We have our welcome bar, which would be about 4 to 5 people, which is our front desk. Every studio has a manager, assistant manager that handles all the things that I don't want to handle. And then in my role as the senior associate, I am the lead dentist at my location, managing our junior associates and our associates. The junior associate is someone that is a year or two out of school. Regular associate is anyone after that, 2 or 3 more years of experience. So, in my role, I have to mentor besides doing the dentistry and, handling anything clinical. When it comes to clinical issues, when it comes to supplies, things like that, I have my hand in that.
Very exciting.
Yeah.
And, us at Ignite DDS and myself, we are Chris Celiano fans for sure. So it's
Yeah.
exciting to see, his role with Tend.
Mhm.
So tell me, did you go into Tend straight out of graduating from dental school?
Oh, no, I did not. I was practicing. I was in traditional private practice as an associate for many years. I actually didn't join 10 until my fifth year practicing.
Very cool. And how many years out are you?
Next six now.
Exciting.
Yes, yes.
We're learning as we go, right? Every
Yeah,
year, I feel like
like,
for
yes.
myself, yeah, I
Yeah,
learned
now
just
it's like
that much
six
more.
years. Oh, like 6 years. I feel old. And we're
No,
still
no.
babies. We're
Yeah,
still
that's right.
babies. We are
That's
new
right.
dentists.
Exactly, exactly. Did you do a AGD or GPR out of dental school?
I did a GPR at Bronx, Lebanon, which is now Bronx Care.
Very cool. And I know
Yes.
that, New York requires PGY1 of some kind.
Yeah.
But if you didn't have to do a residency, would you
Mhm.
have done one?
I think I still would have. I think I still would have just because I feel like dental school just taught us just what we need to do to survive, right? I went to the university at Buffalo, and I believe that they trained us very well. I was very happy with the training I got, especially, once you go into residency and then you kind of see like, oh, okay, I know how to do this. This is how I do that. So I believe we got great training, but there's a limitation, especially in dental school when it comes to the amount of students there are student doctors there are versus the amount of patients, right? So I know like towards the end it's like, oh, I didn't get my bridge requirement. All right, got to do it in typodont. Didn't get my endo requirement. So it's like, did I learn what I need to learn? Yes, but in terms of the practice of dentistry, I didn't get enough practice. So I feel like, you
I
know,
hear you. Yeah.
so I was just like, how do I not do a residency? And there are some people in my class who went straight into practice. Kudos to them. But I definitely think that that year helped me in terms of my speed, in terms of my confidence, because the foundation was already there, right? Dental school gave me that. But when it came to knowing how to deal with patients, dealing with difficult patients, I didn't just have my tier director just say, hey, doc, he he's getting rambunctious. Can come in here with me? It was a little bit more hands off in residency, but you still got someone to back you up. But for me, it was absolutely necessary. At least
Very,
to build that confidence.
yeah, very well said. I feel similarly for my residency. It just helped build confidence, helped me with
Mhm.
treatment planning, helped
Yes.
me ask more questions outside of, hey, outside of that pressure of when we were in dental school where, hey, we just need to get through our requirements so we can
Mhm.
get out of here.
Right. It's like I'm good. It's like, yeah, you absolutely need this amalgam, right? Because I'm
Yeah,
trying to get my amalgam requirement done, And of course, not at the service of the patients. Amalgam is a great material, but in private practice, would I really be doing that in
right.
residency? Would I really
Exactly. Yeah,
like,
yeah, yeah.
yeah, it's 31. Who cares about the color? you know? So it's like
So,
you remove that requirement aspect. Now it's like, okay, what do you need? Why do you need it? Right? Comprehensive treatment planning. Not saying we didn't learn that. Like, yes, we learned the concept, but when it came to what we did in dental school, there were limitations, right? In terms of time. A
mhm,
comprehensive treatment plan is going to take 4 years in dental school with the amount of time we take to
right.
do our visits, the way things are scheduled, what specialties we want to be in. When you're in residency, now you really start to look at those
Yes, 100%.
things.
So, Emma, here at Dental Fuel, we are dedicated to learning from each other's mistakes, and we're here to ask the tough questions about mistakes that we have made in practice. So, my first question to you in your short career so far, can you think about a clinical mistake that you've made and how you managed it?
Yeah. So I have I have one that I would say stuck with me because it was my first like mistake, right? And it happened in residency. And then I have other stories for other things that happen in practice because things always happen, right? And I would say that the mistake was something that happened clinically, but I would say that my mistake was the way I treatment planned it.
Mm.
So, we had tooth number 30, bombed out, decay close to the bone, frication involvement, and I'm trying to be a hero. And I'm just like, let's do the endo. We'll do crown lengthening, we'll do post crown, all these things. The patient bought into it, and I'm doing my endo, and then I cleaned out the canals, and I'm going in with my rotary, and then I start to see blood where I wasn't seeing blood before.
Yee.
And I'm just like, hmm, okay, let's irrigate. Let's irrigate. We're irrigating. The blood just keeps flowing. Let's get an x-ray, right? So, and then I see a nice line right through the middle of the tooth, my first perf. I was distraught. I didn't know what to do. I was just like, oh my God, now the patient's losing the tooth. Like I didn't even know what to do. I left the room. I go to my attending. I explained what happened, and they looked at the x-ray, and they was just like, yeah, okay. What are you gonna do now? And I'm just like,
So calm.
I'm close to tears. And they're
Right.
just like, what are you gonna do now? You perfed right through the frication, right? Can we save this? I'm like, I don't know. Let me look for endo. They're like, Emma, can we save this too? I'm like, no. So, it was at the point where then one of the things is that knowing when heroics is not really going to be a service to the patient. One, two, when you do the heroics, knowing that the bad thing may happen, right?
Right.
And it
Right.
wasn't
Yeah.
that expectation. It's like, I know this is a tricky one, but when something like that finally happens, it felt like the end of the world to me. I felt like I ruined this patient's mouth, and then my attending was so cavalier about it. But to be honest, I felt like that definitely made me feel better because they're like, look, you tried to save the tooth, you couldn't. What are the next steps for the patient? And I'm like, okay, extract, bone graft, implant. They're like, okay, so set the patient up for that. See if they want to do it today. And then I'm just like, you want me to go tell them that I perfed the tooth?
Can you help me do it, please?
Come, and then like, we're not going to tell them no. You have to go tell them, right?
Oh.
So I had to go in there, have the conversation, and they were just like, okay, yeah, you told me that it was going to be a difficult case, and I was just like, okay, so I'm the only one that's at the point of tears. Okay, cool. So like that situation has never left my brain because it's like everything is not the end of the world. One, two, when you make those decisions to try to do heroics or to go with the option that may not be the most ideal option or maybe the option that has a guarded prognosis, you have to know like how do you bounce back if the outcome is not ideal, if what happens in the chair is not ideal, and being 100% candid from the beginning, right? And I think that that's what saved me in terms of rapport with the patient, was that from the beginning I said how difficult it was going to be. Now, did I go to the extent of saying that the tooth may have to be extracted? No, because in my mind, I'm like, oh, we're going to do endo. It's going to be fine. Right. But I think that that is such an important thing that has stayed with me. Like, I kind of went, especially when we're working on something tricky, before I even touch the tooth, I go in like, look, this may not end how we want it to end. I already sent the prescription to your pharmacy just in case. We have the referral right here waiting for you just in case, right?
Yeah.
So, when it works out, then great. Dr. Guzman did a good job, right? But
Mhm.
when it doesn't work out, we're prepared for what we're going to do next. I have the referral ready for you. I already sent the prescription. You don't have to worry about doing that now. And it doesn't look like I made a mistake, right? It's something that happens clinically. And I feel like when it comes to dentistry, it's very hard for patients to understand that line, right? Whereas it's like, you did something. My tooth didn't hurt before, right? So I would say that that was one of the biggest things clinically that, it happened very early in my career. That happened probably 2, 3 months into residency, where after that I had to be like, okay, you have to be very candid with people, even if they might not understand. You need to make them understand to a degree that, you know, when things do happen, and they do every day, if you do enough dentistry, bad things are going to happen,
Mhm.
right? You're going to
It's
have
true.
outcomes that you don't want. You have to be able to manage that. And I would say, just from that, mistake, which is like, is it a complication that could happen? Yeah. But and then after, you're thinking, you're like, oh, was I going too aggressively?
Mm,
How did I end up in the rotation? Like, you start playing back the situation, and as such, mistakes do happen, right? Like, it's a part of the nature of what we do. We see a crown, it looks amazing, then we seed it, we don't push it down far enough, the cotton roll doesn't go down far enough, you see the post op is open. What do you do now?
yeah,
You and I immediately tell the patient,
absolutely.
look, this is not to my standard. I know it's been 2 visits already, but we're gonna have to cut this bad boy off and do this over
Yep.
again. You
We're going
know?
to be seeing you again.
Right. Like, this is actually not your last visit,
Yep.
And it's just like, get
Surprise.
right. And
Yeah.
it happens so much, especially, you do enough endo, you're gonna get and now, 6 years later, have I had more than one perf? Yeah. At the initial I don't do as much endo now, but earlier on in my career, I was doing endo every single day. If you're doing endo every single day, you're gonna get a perf, you're gonna get a broken file, you're going to get an over obturation, and it's just learning how to deal with having those hard conversations, right, with the patient beforehand, making sure that they actually read the informed consent. A lot of the times they don't, right? So then when complications happen, it's such a surprise after, and I'm like, did you?
Mhm.
It's that this is
You
listed.
signed it.
This
Yeah,
is
yeah, yeah.
listed on one of the things, right? So sometimes it's like, you have to go over it verbally, right? Even though it may feel like, oh, this is redundant, they already read it. But sometimes you have to do that, just because they really don't read it. A lot of the times they just sign it. And then now, when I tell you, oh, a file's broken, what? You broke a file in my tooth? This is one of the complications of endo. I thought you read it, right? So, a lot of the times I make it my business to either go over the consent myself, or tell the DAs, like, you have to list them out. Like, these are the things that we need to talk about. So when complications do happen, we're able to manage it a bit easier. Is anyone happy when complications happen? No.
No,
Right?
no.
But we're able to manage it a bit better.
Yeah. So two
Yeah.
things that I'm hearing here are, one, patient communication, huge,
Mhm.
and managing expectations, patient expectations and your own expectations as well too, because things can go south. That is dentistry for you. Even though you think things may go one way, they may absolutely take a full turn around and go the other way.
Yeah.
So
And
that's
giving
crucial.
ourselves grace.
That, yes.
Like, everything, like any complication that happened, the world is over. I'm a horrible dentist. Now it's like, does it still bog me down? Do I still lose sleep over things? Like, I will lose sleep over a crown delivery that I did not like the way that seated, right? Even though I told the member, even though we took a new impression, I I lose sleep over it,
Yeah.
right? Not as bad as before,
Why
but
no?
it still happens, right? And
Yeah,
it's just
I
getting
think we're
over.
all the same. We just ruminate and replay the day and
Mhm.
nitpick at the millimeters that didn't go right from the day. But it's
Yeah.
hard.
And it's
Dentistry's
just
tough.
like, did they not bite all the way? Did I not press down hard enough? And
Right.
then you're just like, what can happen? Oh, now I have to now I gotta block him again for the delivery. And you're
Yeah,
just thinking about all the things. You're thinking about all the things. And you're just like, why did this happen? And then you have to be like, this is dentistry. That's it. Like,
it's dentistry. It's
it's
so
the
true.
practice of dentistry, and you keep
The
moving,
practice of
right?
that's right. We go to work every day to practice and get better at dentistry.
Absolutely.
Join us on our next episode where Dr. Guzman talks about a financial mistake she made. Be sure to connect with Dr. Guzman on Instagram @_Dr.Emma and with Ignite DDS @IgniteDDS.